So the first thing we're going to look at pathology-wise is just, again, general trauma, which is, again, something that obviously with most of the populations we're going to typically deal with. This will be what most people will be predisposed to. So with the kidneys, again, you're looking at trauma to the mid-lower back, and you can see on the pictures kind of illustrated, you can see how the right kidney sits a little lower than the left, and that's because of the anatomy with the presence of the liver in the upper right quadrant. So you can see how the kidneys, while they are partially covered by the ribs, they are slightly exposed. And it's important to also note that as far as participation is concerned, collision sports are contraindicated for a person with one kidney. Obviously, because if they have one kidney and if by chance it did get damaged, then it basically mean they'd have to be on dialysis. As far as trauma to the bladder or urethra, kind of rare in athletics. Obviously, a hit to the lower portion of the abdomen could possibly predispose somebody for this. They do typically recommend that athletes, and most athletes do this anyway, make sure your bladder is empty prior to participating in an athletic event, just because obviously the bladder, more or less, I mean, it's a little, maybe not the greatest comparison, but it's almost just like a balloon. It fills up. So if it's empty, it's obviously not going to be as prone to trauma, but there would be specific signs and symptoms and pain areas noted with trauma to either one of these regions. So looking at renal disorders, we're going to look at urolithiasis, which is kidney stones, and you can see in the picture there is an actual picture of kidney stones on here. That's what they look like. They're basically made up of insoluble salts, calcium, and uric acid, and they form these stones. The other picture is showing you like how essentially a kidney stone forms and how it gets lodged into the ureter and into the bladder. So basically, you know, these stones form. They're very painful, and you'll note where the person has pain. Various different types of things can be used to treat this. Sometimes they will pass on their own, meaning that if a person may get a kidney stone, they may actually be able to urinate it out. It's very painful, but that can happen. And if not, if the kidney stone is very large, there's other procedures that they can do to treat this. The biggest thing with this is, particularly if somebody has had kidney stones in the past, the preventative measures, making sure proper diet, hydration can possibly help prevent the formation of kidney stones. Urinary tract infections can be caused by different types of infectious organisms. You could have bacterial infections, fungal infections, parasitic infections. Really, the signs and symptoms of the different types of UTIs are going to depend upon the areas of colonization. In other words, where the actual bacteria or fungi or parasites, where they actually form and develop. The consequences of urinary tract infections, again, just based upon where the bacteria kind of colonize. Urethritis, which is obviously inflammation of the urethra. Prostatitis, inflammation of the prostate, and polynephritis, which is an infection and inflammation of the kidneys. So again, depending upon where the infectious organism kind of resides will kind of dictate what type of signs and symptoms the individual will present with. Sexually transmitted infections, again, with these, it's going to be important to know what types of infections they are. So what, is it a bacteria, is it a virus? So kind of look at that as we're going through this. So gonorrhea is a bacterial sexually transmitted infection. It can affect other mucous membranes. So again, for instance, like the mouth and the eyes can be affected as well. It can be asymptomatic, however, it can coexist with other infections. So this can be present with other infections as well. The most common sexually transmitted infection is chlamydia, which is another bacterial infection. And with this is another one where, more in particular, women can be asymptomatic. However, even if they are asymptomatic, they can pass the infection on to others. Syphilis is a bacterial infection. What's unique about syphilis is part of the consequences of getting infected with syphilis is the effect it could actually have on other body systems. So the infection can actually produce issues, for instance, in the nervous system and the cardiovascular system. So this is something that, again, starts very local, kind of in the urogenital system, but can eventually progress and cause issue with other symptoms. And a lot of individuals can experience symptoms for up to 3 months after exposure to the infection. Genital warts is a viral infection caused by the papillomavirus. So this is another sexually transmitted infection, and it is also a primary cause of cervical cancer. Some other sexually transmitted infections, you have the herpes virus, which you have two different types. The type we're going to focus on here is the type 2, which is the genital herpes, or the type of herpes that is typically transmitted sexually. Type 1 is the non-sexually transmitted herpes that you either get on the lips or on other areas of the body besides the genitals. Any herpes infection can affect any mucous membrane, and something to keep in mind is that any initial infection with herpes remains in the ganglia of the associated nerves. So in other words, this is when someone gets infected with a herpes virus, they always have the virus. So they'll have their initial outbreak. Once the outbreak goes away, there's always the chance that it will likely come back. So, and there's different medications that people can take to control those outbreaks, but it's a condition that they never totally ever get cured of. It's just that the symptoms kind of go into remission after the initial infection. Pelvic inflammatory disease is an infection, usually as a complication of some other type of infection like a chlamydia or gonorrhea, and that infection could affect the cervix, the uterus, and the fallopian tubes. Renal failure or kidney failure, and you have two different types. You have acute and chronic. Acute renal failure is going to be caused by some type of ingested toxin or possibly even an obstruction of a ureter from the kidney. So in both of those situations, it could be that the kidney just gets overwhelmed with its filtration responsibility and damage occurs. Chronic is unlikely going to be due to or seen in younger active individuals. Usually you'll see that in older individuals, or usually as a complication of some other type of issue. So in other words, like diabetes or hypertension are things that will do that. And when you're looking at the signs and symptoms of chronic, initially the person could be asymptomatic. So when you look at your signs and symptoms, just note that particularly in people who have chronic kidney failure, many times you don't see that right away. And something just to be mindful of is that the kidney cells, once they die, they cannot regenerate. So obviously if a person goes into renal failure, those cells that die as a result of that will not regenerate. So some urogenital disorders specific to males, you have monorchidism. So monorchidism is the absence of one testicle, and that could be something that's either congenital or traumatically acquired. So in other words, a trauma to the testicles caused one to be damaged, and they only have one. Prostate disorders, so the prostate gland sits at the base of the bladder. So you can see on the picture anatomically where the prostate gland is. And in a situation where an individual get chronic or even acute inflammation of the prostate will swell and get inflamed and cause various urinary symptoms associated with that. Any type of prostate disorder, again, so you could be looking at more of like a chronic acute infection. You could be looking at prostate cancer, which obviously you'd only really see in older individuals. The same with what they call benign prostatic hypertrophy. So some males, as they get older, through natural just aging process, the prostate does enlarge and they could begin to have urinary symptoms with that. So chances are, if you're looking at a younger individual, you're probably looking at some type of prostatitis, not per se a benign prostatic hypertrophy. However, some of the signs and symptoms that they may experience with the prostatitis could be very similar to just the benign enlargement that some older individuals get. Testicular trauma or testicular torsion. So Testicular trauma is obviously not uncommon in sports, particularly if an individual does not wear any protection while they're playing the sport. Testicular torsion is something a little more serious, where as a result of the trauma, the spermatic cord actually gets twisted. So the torsion, it's usually something that happens more during adolescence, when there's some physical changes taking place, but it can also happen in older males as well, so where the spermatic cord actually twists. So the mechanism of injury with that is typically trauma. It can happen without trauma, but it's not as likely to occur. Obviously, the major complication associated with that is the compression of the arteries and veins that lead to the testicle, and it could cause infertility if it remains that way for a long period of time. Most of the time, testicular trauma, when it does happen, it is benign. It just is a matter of making the individual comfortable. If you do have a male athlete that does get hit in the testicles, it's really important kind of note how long they're having their pain for. Typically, pain should resolve within about 10 minutes. If the individual is having pain well beyond 10 minutes, and they may even note that they could almost feel a deformity, particularly as you can see in the picture, like the one testicle gets elevated because of the twisting at the cord, then you know that there's likely something more serious, and that needs to be dealt with immediately, so that the individual does not risk infertility. Varicocele are varicose veins in the scrotum. So these are when you get enlargement of the veins. You probably have heard of varicose veins. Typically we think of them being in the legs, where the veins get enlarged. This can also happen in the scrotum in males. And many times younger individuals will just complain of like a heaviness or a tenderness in the area, and then it would just be important to get that individual referred to make sure there's no complications associated with it. A hydrocele is a fluid-filled sac that could form behind the testicle, so that would be something that could actually occur as a result of trauma as well, the hydrocele. So the hydrocele is just a fluid-filled sac. The varicocele is when the varicose veins enlarge. Testicular cancer is something to make note of, because its initial presentation can happen in younger individuals. So 15 to 35 years of age is actually where this can potentially show up. Many times this happens as a result of something called cryptorchidism, or an undescended testicle. So sometimes when males are born, the testicles don't drop, and if one in particular stays up in the pelvic region, that maybe has to be corrected. They tend to have a greater chance of getting testicular cancer. It's a very treatable form of cancer. It'd just be very important to encourage young males to do just regular self-exams in the case that they possibly feel a lump or a lesion on the testicles, to have that get examined. So now looking at female urogenital disorders, endometriosis is when endometrial tissue forms outside of the uterus. This is more common in ages between 30 and 40. You can have initial symptoms sometimes in younger females, but that's typically a lot of times where this shows up. If it does show up, particularly in a younger female, that it's important that it gets corrected and dealt with, because it could cause potential infertility. And we're going to talk about pregnancy, and I do want you to include pregnancy in your chart. We're not looking at it as a disorder per se, but it is a condition because of the fact there's a lot of physical changes that go on with the woman's body when she is pregnant. So many of the initial symptoms that occur are typically caused because of the elevated level of hormones. So for instance, typically we think of something like morning sickness. And that's, the nausea and everything that comes with that is, again, because of the surge of hormones that happen. You usually look to have, so really important, I want you guys to know and understand the physical changes that occur with pregnancy, the important ones, because obviously we could be in a situation where you have say for instance, you're working with a sports team and a female athlete gets pregnant. You'll be responsible for, obviously overseeing that individual's activity and what would be safe for them to do, once they have to come out of their sport, what type of exercise and what are some things they could do to maintain their physical qualities for their sport. You typically look at a weight gain between 25 to 30 pounds in pregnancy, due to obviously the weight of the baby and some of the other physical changes that occur in the female. One important hormone to understand is the hormone relaxin. Relaxin is a hormone that actually makes the joints more hypermobile. So that's something really important to note in, again, particularly if you're working with an active female and you're having them do exercises, be aware, think of what exercises you're having them do so that they don't end up injuring themselves just because of their joints being loose. And a common area where you see problems with this is at the SI joint in the low back and pelvis. So it's very important to do that. And then another thing to note is the heart rate and blood pressure changes that occur. So the heart rate will usually increase by about 15 beats per minute, and the blood pressure should progressively decrease over time in the pregnant individual. So important to just kind of discuss and expand on our exercise guidelines for pregnancy. As always consult with the physician. It would always be a good idea to have a conversation. I mean, for the most part, most forms of exercise, many women, particularly women who are very active before they get pregnant, tend to still be very active while they're pregnant. Actually, a lot of the reasons why they'll tend to pull back isn't so much that it's per se dangerous for the baby. It's actually just physically because of the changes that their bodies go through. They just can't do it anymore. You could look up, there are case studies of women, participating in a pretty vigorous activity while they're pregnant. I actually have some of the contraindications listed up here. So a contraindication is when you're not permitted to do something. So exercise would be contraindicated in a situation if a woman has diabetes, hypertension, history of miscarriage, or the presence of multiple fetuses. So if a woman is going to give birth to twins, triplets, just because of the potential complications with that to start with, they typically deter from exercise. You need to be aware of the intensity of exercise. So you want to look up where you want to keep. They recommend certain heart rate ranges for the intensity of exercise. There are some guidelines for NCAA gives for participation with activity. So very important to kind of follow those. And then you have to look at the postpartum period. So the postpartum period is 6 weeks after the woman gives birth. So the body obviously went through a lot of changes in order to birth and carry the child through the pregnancy. Now the body has to kind of come back to its regular state. So very important that you, again, even during this phase, to kind of watch what the individual does activity-wise. So make sure that, again, be careful of exercise in hot, humid weather. You still have to be aware of like excessive stretching and things like that, range of motion at the joints, because the effect of relaxant could still be present. And you need to make sure that if the mother is going to breastfeed, she needs at least an extra 400 to 600 calories a day to maintain for breastfeeding. And actually, I'll back up a second. While the woman is pregnant and exercising, she needs at least another 300 calories a day during that time. So an extra 300 calories a day while pregnant, postpartum period for breastfeeding to maintain that, about 400 to 600 calories a day.